Hello, families. It is Crystal Sanford here, your host for Thriving Special Families, where we offer insight, humor, and hope to your special needs parenting journey. I'm so glad to be here with you today for another episode, and our topic is Ask the Doc. I've been really looking forward to this episode where we get insight from a pediatric child psychiatrist, Dr. High. Hi, Dr. High.
Hi, Crystal. Thank you so much for having me today.
Oh my gosh, such a pleasure, and so glad to have you here for another episode. So, families, if you are listening to us in our podcast, I will say welcome to Thriving Special Families. You are in the right place. If you're watching us live, welcome as well. Feel free to add your comments to the questions in the comments area, and we'll do our best to answer those along the way. And lastly, please know that the information that is shared here is for your informational purposes only. If you are in need of advice in the legal or medical area, please do contact a specialist in that area. So again, today, our topic is Ask the Doc. What are your questions for a pediatric child psychiatrist? And it is just really an honor to have you here, Aneita. You know, I think that we don't often have access to professionals in this capacity, so I really do value your time and thank you for being here with us.
You're so welcome. I'm always willing to help special families.
Awesome. Well, a little bit more about Dr. High. First of all, she's a dear friend of mine, and I'm really glad to have her here. But also, Dr. Aneita High is a board-certified psychiatrist in child and adult psychiatry. She completed her BS in psychology at Yale University, and then she received her medical degree from the Medical University of South Carolina. She completed her adult residency and child fellowship at UCSD. Her passion for working with at-risk youth and vulnerable populations has resulted in 20 years worth of experience in correctional, psychiatry, adult and child residential care, as well as day treatment, inpatient psychiatry, and school-based and community-based clinics. Dr. High has started on going on mission trips as a teenager, and now that has caused her to have a global focus, and this focus on global citizenship has prompted her to complete a master's in public health at George Washington University with a focus on global mental health. In addition to practicing psychiatry, Dr. High spends part of her time in Kenya, serving alongside her husband in Teule, Kenya, a registered NGO that serves orphaned and vulnerable children. So, wow, what an honor, what a well-rounded experience that you have that you can really speak to. And I know just personally the great assistance that you've provided to many children with unique needs.
Thank you, Crystal.
Yeah. So tell us about what led you to the field of child psychiatry.
So my dad is a physician, so I've always seen doctor-patient relationships, and growing up, I've always had a love for children. I can remember even in high school, my sister and I, we would volunteer and help in like the kindergarten class and so forth. So going into college, I was convinced I was going to be a pediatrician, and I went through undergrad, and then I went to medical school. And when we started our clinical rotations, my first rotation was in psychiatry, and I absolutely fell in love with it. My last rotation that year was going to be pediatrics. And so as much as I love psychiatry, I thought to myself, let me see what pediatrics is like before I make a decision. And during my pediatrics rotation, I realized that there are like two extremes in pediatrics. One being, either it's like the same well baby checks, ear infections, or totally devastating like cancer or like chronological illnesses that these kids are going to have to struggle. And so that kind of made it the decision for me. I decided that then. I was going to be a child psychiatrist, and I don't regret it at all. I absolutely love child psychiatry. I love working with families, and especially when children are first diagnosed and there's a lot of uncertainty, there's a lot of grief. Just being there to help walk alongside families and parents and recognizing that a diagnosis is not your child's future and that there are ways to help them overcome whatever challenges they're going to face. And then being able to see some of those successes it's just really, really great.
Oh, that's awesome. That's beautiful. And you are one of, I guess, I'm not sure, but maybe many psychiatrists who do value that clinical relationship and do a little bit of that counseling along with the medication care. Is that right?
Yes, absolutely. Yeah, we like to do I think psychoeducation is really important, having a good understanding of what the diagnosis means, what it's going to look like over time, prognosis, and basically just helping them see that it's not an end, it's going to be a journey, but with the right tools and support, there can be success.
That's awesome. Well, we already have a question from our audience, and Nancy says, hello, Doc. I was wondering what new challenges you're seeing in kids due to the events of last year. Are there any new studies going on because of last year and referring to the coronavirus pandemic, all those things?
Yes, there are a lot of challenges that youth are that we're seeing in our young population in regards to increased levels of anxiety and depression, challenges in education, as we all hear on the news and see. And so we definitely are seeing those challenges. And, special needs families, I believe, are getting like a double hit because then the access to resources has been limited so much. So yes, absolutely. There are studies that are tracking some of these things and looking at what the immediate effect. I think we still going to take some time to understand what the long-term impact of this year and this new normal that we're getting used to is going to have on our children.
Yeah, I believe that we will continue probably more and more information that comes out in that regard. So, Aneita, what is one of the biggest misconceptions that people have regarding children and medication, especially as we are special needs families here? I often hear, as I serve families as an advocate, as a speech pathologist, I hear parents say, I don't want to put my child on medication or, not my child. What are some of those misconceptions?
So it's interesting. A lot of the misconceptions are almost on like the opposite side of the spectrum. So you have kids that you'll have parents that will say, I don't want my child to be drugged, or I don't want them to become an addict.
Right.
Or the other extreme is, I just need a medication who's going to fix it. That's going to fix things. And so this extreme of, if I put my child on medications, I'm going to create a foundation of dependency on medications, or even am I going to drug dependency, illicit drugs, or the idea that if I get my kid on medications, it's going to fix everything and I'm not going to see any problems anymore. And so addressing both of those is different, of course, as well as looking at what is the situation, what are you trying to accomplish with medications, what's the diagnosis, what are behaviors or symptoms that medications are going to address, and what are some behaviors and symptoms that the medications are not going to address. And so having a realistic expectation when you're going into, do we need to start with medication management? Is this going to be part of our toolbox in recovery and treatment?
Yeah, I love that. And that's, I talked about that in the description of this episode, is that for some children with unique needs, medication can be part of the plan, right? And so it's not the one and only source of providing support, but it can be a part of that plan. And families, if you're just joining us, welcome again to another episode of Thriving Special Families. This is your show for insight, humor, and hope along your special needs parenting journey. Our topic today is Ask the Doc, Insight from a Child Psychiatrist, and we have Dr. Aneita High here. So, Aneita, what is it that you have as insight for families who have children with behavior struggles? What if these parents, they have children with unique needs? Maybe it's autism. A lot of our parents have kids on the spectrum, or ADHD and such. If their child is struggling with behavior, what insight do you have for those parents?
So when you're addressing the problem, there's several things you need to look at. One is, how old is my child? And so how much of these behaviors are age appropriate, because we know that age appropriate behaviors occur within a spectrum. So is my kid just on the far end of normal, or is this a significantly abnormal behavior for this age group? And when you're working with families that are involved or who have children that have maybe intellectual disabilities or autism spectrum, then you also want to look at the developmental age, not just the chronological age, because there are some behaviors that might not be appropriate for their chronological age, but because of their developmental age, it would be within the realm of normal. So that'd be one thing I would think about and consider. The other thing is there another diagnosis going on? So are we seeing behaviors that are related to the autism spectrum or intellectual disabilities that are very common, or are we seeing something that might be what we would call an axis 1 diagnosis? Like, is there an underlying depression? Is there an underlying anxiety disorder? Is there something else that's going on? Also in this population, is there a learning disability? So there are certain things, like we said, that are going to be addressed by medications. And then there are also others that might be addressed more appropriately with behavioral or psychosocial interventions.
Okay, that's really good to think about. And that makes me think about as well, and the research that I've done around autism is one example. Often these secondary types of diagnoses come along as they get older. The depression, the anxiety, those things maybe show up as they get older. And so that's something really to consider, that the age does make a big difference.
Yes, absolutely.
Now, what about our parents whose children, again, maybe I'm thinking ADHD and autism, these children are struggling with sleep. Is there a place for medication when it comes to that?
Absolutely. Sleep problems, I think, insomnia is probably one of the most problematic mental health symptoms across the board. And especially when you're working with children who might have some developmental delays or other special needs, sleep is so important for development, for growth, for learning, all of those things. And so in addition to it being a habit, a behavior, looking at what's happening, I always will encourage behavioral interventions first, especially for something like sleep, which can be impacted so much by the environment, by, whether it's the noise, heat, cold, the activities that the children are engaged in prior to going to bed. I highly recommend having a sleep routine. I even recommend that to my adult patients. And knowing that if you've had sleep issues for extended periods of time, having a realistic expectation of what your sleep is going to look like. If you've had sleep problems for years and years and years, you can't expect to try an intervention or a behavioral change, and then in 2 weeks, I'm sleeping 8 hours a night with no interruptions, no problems falling asleep. That's not realistic.
You mean that's not going to happen, Dr.
Exactly. It's not going to happen. It's not going to happen. And so once we kind of work on a sleep routine, then looking at maybe some over-the-counter medication options like antihistamines or melatonin, which is another dietary supplement. very rarely will I offer or suggest using a sleep aid, because long-term use shows that it's not effective.
Oh.
And I'm thinking of things that really aren't even indicated in most child or pediatric populations, but just if you're even with older kids that are maybe late adolescents and like, oh, should I get an Ambien or can I get on different other sleep aids, prescription sleep aids? They don't have long-term benefits. Well, they have long-term benefits, but it's not as not as successful as if you're going to make these behavioral changes, especially with these chronic sleep problems. So for children, the behavioral and then trying the over-the-counter, having realistic expectations. Maybe it's about just allowing your child to have rest time. They might not be sleeping the whole time, but how do we train them to stay in bed until a decent hour?
Yes,
Different things like
at least. Yeah.
yeah.
Wow, that's so helpful. Thank you for sharing that too. And things that, as parents, as novices in this area, we may not necessarily know these things. So that's really interesting to know that long term, these kinds of medications for sleep aren't normally seen as being as productive or as helpful.
Yeah. And even when I'm prescribing something like melatonin or even an antihistamine, the long-term goal is to get somebody back onto a regular sleep cycle. And for each person, that will look a little different. There are some people that can do well on 6 to 8 hours of sleep. They're not groggy in the morning. It's not affecting their concentration later in the day. So you also want to look at the functional impact of the insomnia. Like, are you noticing that your kid's more irritable when they're not getting the sleep they need, or they're not able to concentrate in class as well when they're not getting the sleep they need, or they're more fussy, or, those type of things, as opposed to sleep in and of itself. And I think kind of looking at what's the functional impairment that's connected to the lack of sleep.
Now, for our parents whose children are already on medication, let's say maybe for attention deficit, or for example, when does the parent know it's time to make a change to either the medication or the dosage of the medication? What are some indicators for that?
That's a great question. Thank you, Crystal. So, like, again, we're looking at functional impairment, and that's what we hope the medications can help with. So whether it's inability to complete task in the classroom, or having more challenges or taking longer to finish their homework, is it more behavioral infractions in the classroom? So what were those symptoms or behaviors that were going on that prompted your treatment team to think of, okay, maybe medications might be a good intervention in addition to what else we're doing? And then if you had some level of control or benefit and you're no longer seeing that, that doesn't necessarily mean there needs to be a med change, but there needs to be a reassessment of what else is going on. So oftentimes, I will see a need for a med change is the transition from elementary school to middle school. One of the reasons being that I'm trying to figure out a good way to say this. One of the reasons being that the demands on their attention and organizational skills greatly increase in middle school. Before, I used to have one teacher who'd give me all my assignments, and that teacher was aware when everything else was needed to come in as far as the assignments. Now I have multiple teachers with different expectations, different amounts of homework, and that puts more demand on the child, how to plan, how to organize, and especially with children with ADHD, that's an area of deficit for them. So are there some external things that you can do to help them have that external organization that maybe they won't internally be able to do as well as maybe their typical peers? Or is this a time for an increase in medication. Another time that you'll see if there's like a huge growth spurt, a lot of times when you start medications at younger ages, it's based on weight.
Okay.
So as they get a lot bigger, they might need higher doses. And you also have times where kids are tired of being on meds.
There you go.
And they're, I've taken meds for X amount of years. I want to try it on my own, or I want to do it by myself, or I don't want to take medications anymore.
Yes.
And I think it's very important, especially as children are getting older, in adolescence, for them to take more ownership over managing their symptoms. And when we have those situations, you sometimes have parents like, no, don't take off the meds. But at the same time, do you want to be fighting with a 15-year-old? So, it's one of those things where it's important to have that conversation with the child. What's their motivation to getting off medication? What else are they going to do to manage their symptoms? Because it's not just, I don't want to take my meds. Okay, you not taking meds doesn't change your challenges. So what else are you wanting to do instead?
Okay.
And I think those are some important conversations to have when you're looking at making change. I hope they answered the question.
No, it does. And it just makes me think about a student that I worked with. I've been just for 20 years, so I've interacted with days, and I can think about a kid in worked with, and they seventh grade and to stop taking the medication, and he saw his grades really drop. He didn't like the fact that he didn't have an appetite. He didn't like that he wasn't hungry in the day, and he wanted to not be on it for a while. And he saw his grades drop, and so his parents and him, and I'm sure his medical team had to make some decisions in regards to that, because in that case there wasn't, like you just said, something in place to further assist him. He still had the same issues, so if he wasn't using medication, he needed something. And so as an advocate now, I'm able to help parents in that way. We can put some things in place in the IEP. We can put in some additional supports. Maybe there's occupational therapists that can help provide some supports around organization and planning, so that something is in place to help the student in lieu of them taking that medication.
Exactly. And actually what I like to do when that question comes up when I'm treating a patient, and it happens with children and adults, I don't want to be on meds anymore. And I ask them the question, is your goal not to be on medications, or is your goal to be healthy and functioning? Because those are two different things. And we can accomplish one at the expense of the other, or we can make the goal, how can I be functional and healthy? Wow. Function to my best ability.
Right.
And minimize my medications.
That is a good question. And you're so good at that, just as a human, asking those poignant questions that make us think. As a friend, I have appreciated that. But as well, I think that's a great question to ask, a young adult or an adult, because it matters, the answer to that, when you're determining what the next steps are, right?
Yeah, absolutely.
That's great. So another question I have for our families whose children are, again, maybe they're on medication for whatever reason, how does that impact the summer? I often hear parents talk about that. Well, I don't like my kid being on medication, so at least I'm going to take them off during the summer. I know for some meds, there are some real ramifications to that. Can you talk to that?
Yes. So again, you have to consider, what's the diagnosis? What are the symptoms that you're treating? Are these things that go away when your kid's not at school? Okay. Or, and what's your motivation? Again, is it just that you want your kid not to be on medications? Or, like, for example, especially with kids who are on stimulants, who are have ADHD, because of the suppressed appetite, they might lose weight, and the parents might see the summer as a time to fatten them up. But I ask them, do you think your child still needs to be able to have good attention and focus? You know, are there things that they're going to be doing over the summer that they're going to need this extra resource to, and then it becomes a personal choice for the family. You know, is your kid going to be in summer school? Are they going to need to be able to concentrate and get highly focused work done, especially at the rate in which information is taught during summer school in such a short period of time? So that would be very different from a child who maybe suffers from anxiety, maybe has aggression problems, and now they're on medications for those type of things. Knowing that summer is a less structured time, where there's more opportunities for dysregulation.
Yes.
Probably not the best time to get off medications. So those are conversations you want to have with your provider in, you know, why is it that you want them to come off the medications for the summer? What are you hoping to accomplish? And what are their needs? What are going to be their psychosocial needs over the summer break without the structure of school and those type of things?
Wow, those are some great points to consider. That, you know, that's amazing. Thank you for sharing that. You know, Dr. High, well, first of all, you're only in the U.S. for part of the year, so you're not necessarily accessible to families all the time. But what would a parent look for in a psychiatrist for their team, right? So you happen to be board certified as child psychiatrist, and for adults, what might a parent be looking for, especially if they have a child with unique needs as they're looking to find a child psychiatrist?
Yes. So board certification is great, but the people who are board eligible, or physicians and psychiatrists who are board eligible, went through the same training as individuals who are board certified. The primary difference between the two is, to maintain your board certification, you have to go through certain levels of continued medical education that goes beyond what you need just to maintain your license. So these individuals are constantly updating their knowledge, because we know in a field like psychiatry, things are always changing and advancing. So that's one thing as far as the differentiation. The second is, talk to the psychiatrist. A lot of psychiatrists will let you know, based on the information that you give them, if they think that your child is a good fit, if they feel like, okay, these are behaviors, disorders, diagnosis, whatever, that I feel comfortable treating. And if it isn't, they usually know who in the area is. So, you know, whether it's through your insurance panel that you get a couple names from a psychiatrist or whatever, I would interview them. And I personally feel, especially with mental health, that having a good rapport with your clinician is very important, and your psychiatrist is very important. And you can kind of treat it like a blind date. You know, where maybe I'll give you like 3 chances to see how we click. You know, maybe the first one might not be great, but after 3 sessions, you should know, okay, is this going to be a good fit or not? What I will caution you is, don't jump ship until you have somebody else, because historically, the waiting list to get into be seen for a new psychiatrist tends to be anywhere from 2 to 3 months.
Oh, wow.
For an intake. That will vary based on your area, and the availability of child psychiatrists or adult psychiatrists who feel comfortable working with children. And if they do say they feel comfortable working with children, find out the age range. Most adult psychiatrists will feel comfortable working with adolescents. And then depending on the diagnosis, maybe even younger than that.
Okay. That's really good to know. That's very awesome. You know what? And I'm thinking, as well as we are having this conversation, is I probably should have asked a real good question at the beginning, because for some people, maybe they're still a little confused. What is the difference between a child psychologist and a child psychiatrist?
Yes. So basically, the difference between psychiatry as a field and psychology is psychiatrists are medical doctors. We have to attend medical school. And then after we do our general training in medical school, we specialize in psychiatry. So we are aware of some of the psychological theories. We are exposed to being therapists and working with the caseload with one-on-one therapy, but primarily we're trained in medical interventions for mental health, whether it's medications, ECT, hospital care. That's where our training really, the experience that we really tend to have that differs from what you would see with a psychologist. And the other thing with psychology, it's a vast field. So the difference between a clinical psychologist and a social psychologist or educational psychologist is also very diverse. So when you're working with a psychologist, being aware of what expertise they have, whether they in behavioral interventions, in group therapy, one-on-one therapy, those things are very important to find out.
So that is really good to know. So potentially a parent could have maybe a clinical psychologist on their team, maybe doing some treatment, as well as having someone like yourself, the psychiatrist, doing the medication management, all these people on the team.
Yes.
Yeah. Awesome.
And then I'll also mention that pediatricians are pretty well trained in prescribing medications for ADHD, kind of basic mental health services. And when they get to the realm of their expertise, they'll let you know. It's like, okay, I've used all my bag of tricks in treating ADHD. Now you need to go on to a psychiatrist.
Okay. That's good to know. That's awesome.
Yeah.
And I guess a follow-up question to that would be, what types of cases do you find yourself treating, and how that might differ from like the pediatrician, for example, who also gives medication? Is it the kids who have really high needs? Is that who goes to a psychiatrist?
Typically, what's not able to be managed in a primary care setting will usually be referred to a psychiatrist. And I would say that most children on the spectrum would need to be treated by a psychiatrist, unless they're super, super stable, very high function with minimal medication interventions needed. If you're looking for medication interventions, I would go with the psychiatrist. A child with ADHD, very different, more common, and doesn't require that level of expertise. A child with a serious mental illness, like say OCD, or so there's several types of anxiety disorders. If your kid has generalized anxiety, probably could be seen by a clinical psychologist. If it's getting to the point where you need medical or medication interventions, you probably need to see a psychiatrist. Now, that doesn't mean that once they're stabilized that they can't transition back to their primary care doctor for management. But in those initial stages when you're trying to find which medication is going to be beneficial for your child, trying to get them stabilized on a regimen, working with a psychiatrist is really important.
That's really good to know. Just knowing kind of the steps to take in the process, especially if parents maybe are new, they're just kind of figuring this out, or finally ready to delve into this area with their child's mental health. It's kind of good to know those steps and who to go to. Yeah. So, thank you so much, Dr. High, for being here, for being available to take our questions and providing some insight around mental health and psychiatry and medication for our kiddos.
Great. You're welcome.
So families, thank you again for joining us for another episode of Thriving Special Families, sponsored by Sanford Autism Consulting. If you have questions, feel free to email us at thrivingspecialfamilies@gmail.com. Also, if you're in need of IEP assistance, always feel free to reach out. at 619-403-9097 for Stanford Autism Consulting. Again, our episode has been Ask the Doc, Insight from a Pediatric Psychiatrist. Thank you again. And always remember, families, you're going to be okay and your child's going to be okay too. Thanks so much.